Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. This episode features perspectives of caring for aging patients with HIV. During this podcast, Dr. Cristina Mussini provides her approach to empowering her patients, especially women, to age healthy with HIV. For more information about Dr. Cristina Mussini and for a link to the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Mussini has to say about this topic.
I'm Cristina Mussini. I'm professor of infectious diseases at the University of Modena and Reggio Emilia, and I'm the director of the clinic. HIV has been my main field of interest since the beginning of my career, and I'm in this department since 1988, so a long period of time. I'm still seeing patients because it's really something that I like to do. And I hope that what I will say could be helpful for all of you. I think that the problem of living well while aging with HIV, it's very relevant. And I think that the role of doctors is at first to think about it. I mean, the problem is that you have to have in mind every time you see your patient, each time you see your patient, not only the CD4 and the viral load, but really what is relevant for the patient in that particular period. And the period could be, when they are young. There could be, for example, if they are women, like contraception or, safe sex or whatever. Getting older, I think that at a certain point, and it's what I'm telling my patient, is that at this point, when you are in your 50s or you're in your 60s, you have to think and to decide, how do you want to get old? How? It's important to lose weight, not to be overweight, because we know that getting old, you can lose mobility. I mean, you are more rigid. And so it's important to lose weight because the weight is bad for the joints and whatever. So to have cardiovascular events prevention, that is moving, just walking, not big things, but just walking. I always counsel the patient to count their pace with the cellular phone, with the watches or whatever, but in order to be focused on it. Because when you ask someone who is very overweight, they say that they don't eat anything. Because if you don't monitor, you don't have the perception. So the first role that we have is to ask our patient to monitor their activities. That could be what they eat, not in an obsessive way, but just to know that if one day you had a big lunch, maybe the day after you can have a salad, but just to keep a balance. Our goal is not to go on the cover of Vogue. It's important to understand that we, probably because I'm working at the hospital and also during COVID, I've seen all these people in their 60s or 70s with a lot of problems and really frail. So it's important to start much before in order not to become frail. It's not something that you could decide when you are 80 or 70-year-old. And especially for women who have to be caregivers almost all their life. But at a certain point, they are not caregivers. And because the children are grown up and unfortunately the parents died. So it's time to focus on themselves. So I think that the prevention really passes through the self-esteem and how do we want to get old. And this is the first thing. The other thing is, because we are really, as doctors, as clinicians, a cherry on the top. I mean, it's not that we are the whole cake. We should help our patient in taking care of themselves. That's the only way, because it's important. For example, for cancer, it's fundamental that we prescribe all the prevention measures, mammography or the pap smear, the anal pap smear. I think that this is very important, colonoscopy and whatever. But all the habits that could decrease the risk of developing a cancer, they are up to the patient, up to the person living with HIV. And since we moved from patient with HIV to people living with HIV, this meaning that HIV is not what you are. So it's not that you're not dying of AIDS, as it happened when I was a young doctor. You should really see HIV as something that is a little bit external to you. Even if the chronic inflammation just, has a deleterious effect on aging. And that's why you should take correctly the medication. But nevertheless, it's fundamental to keep all these activities in order to age well. It's not the pill, it's not the antiretrovirals that help people living with HIV in aging well. Is their lifestyles. And also, I think, and that has been approached also during the event, I think, the problem of stigma. I really think that we have two kinds of stigma. One is the one of the society that in most of the cases goes with not knowledge. People don't know. So if they are scared or they think that they could judge, and that's really bad. That's one of the reasons why people do not disclose so often. But on the other way, there is also a self-stigma. And this is something that it's like carrying a backpack with 100 kilograms, because it's something that keeps the people, people living with HIV, making them feeling different. This is a stigma for HIV, but it's the same for people without HIV. There are people who don't love themselves for many reasons, and this is a huge obstacle for aging well, because it's, if you think that your life is different and that you don't have the capability of improve your life, this is something that is a great obstacle with living well while aging. And I think that we have two things that should be in parallel. The first one is that as doctors, we should do our best in monitoring problems related to aging, or also to previous antiretrovirals. So look at the bones, look at the kidney, having the viral load absolutely undetectable, or performing all the screening for cancer. On the other hand, I think that it's very, very important to make our patient feeling important, that we care for them, that what we are talking to them, what we are telling them, it's because we care. I always tell them, you will be followed even after my retirement. For me, I care. I mean, for me, it's important that you age well. So it's important that you take care of yourself, but that you take care of your diet, of your exercise, that you quit smoking, that you don't drink or don't drink too much. I mean, I think that it's very,